Inserting a peripheral IV.
Today we will be demonstrating insertion of a peripheral IV. As with any procedure, when you get ready to do something, you want to verify the physician's order. You want to wash your hands, you want to provide patient privacy, you want to explain the procedure to the patient and identify the patient. Mr. Smith, can you tell me your name and date of birth? He says Mr. Smith, he tells me his date of birth, it matches. So one thing that I want to ask you, Mr. Smith, is do you have a preference on where I start your IV? Some patients have a preference. If they're right-handed, maybe they want the IV in their left hand. If they've had breast surgery or lumps removed, then you're not supposed to start it on that side. So you want to make sure that you're asking the patient what they prefer. And while you're having this discussion with them, you're also doing your assessment and you're kind of eyeballing their veins as well. I see one that I think that I would like to use. It looks straight, it looks bouncy, so I'm just gonna do a little assessment of that real quick. But before I open my packages, let me show you the supplies that you will need. You're gonna need an IV start kit, and it has your gloves, a tegaderm, and tape in it. And you're going to need, of course, a gel coat, which says this is the top wrapper, and it indicates the size of the needle that you're using, and you'll need that for documentation purposes. You're going to need a saline flush, and I'll explain that in a minute. And then you're going to also need extension tubing, because the extension tubing is what makes it a saline lock. So we're going to start an IV, but then we're also going to put this extension tubing on it, making it a saline lock. So I'm going to open my packages, and I see my tape is right here, so I'm going to open my tape, and I'm going to get a couple of pieces out because I will need to secure the IV site after I insert it. I'm going to get my tourniquet out of my package. You don't want to leave a tourniquet on for longer than 2 minutes. So while I'm talking with Mr. Smith, I'm going to go ahead and apply the tourniquet 4 to 6 inches above the insertion site. Now, granted, this is a mannequin's hand, so 4 to 6 inches would be up here, but we're just going to pretend for this purpose. I've applied the tourniquet. I see that the vein is nice and straight. I don't see any bifurcations that I notice. I don't see any other veins coming in that would indicate a valve, which would make it difficult to advance the catheter. It's a nice, soft, plump, bouncy vein, which is what you want. So then I'm going to take the tourniquet back off. So now I'm going to, before I go too far, I'm going to get my extension tubing out, and I need to prime it because this extension tubing comes just with air, so you need to prime the extension tubing. So you open the extension tubing, and then you pick it up out of here. Now this is a sterile thing. Nobody's touched this port. If I opened it and I was handling this and palming this, then I would have to clean that. But if I just pick it up very gently out of here, it's clean and it's sterile already because it's packaged that way. So I just need to get the air out of my saline syringe. Always, always, always get the air out. You open a saline syringe, you get the air out. And then I'm going to connect it. And then I'm going to pick it up, and I'm just going to hold it right here so you can see as I'm priming it. Do you see the fluids coming out? Do not take this cap off yet. It is a vented cap, so you can prime around it. If you take it off now, you're going to contaminate the area where you're going to apply it to the gelco. So don't take it off now, but what I do want you to do is just loosen it a teensy bit so that when you do go to apply it, you don't have to struggle with taking it off. And then you just place this gently back down in the package where it came from. So now you're going to put your gloves on. Again, this is not a sterile procedure. This is an aseptic, no-touch procedure. You want to protect yourself from patient's blood or body fluids. So you just put your gloves on. Okay, tegaderm. This is the tegaderm, and you want to write your initials, the date, and the gauge on it before you apply it. So you will do that now. And then you're going to need a 2x2 nearby. And then this is the chlorhexidine cleaning agent. So you want to squeeze it, and you'll hear a cracking sound. You tip it upside down, and then the fluid will come to the spongy part, okay? So now you want to apply your tourniquet. Nice and tight. And you want to start to clean the area of insertion. So you want to start in the middle there and just start to clean around it using friction for 15 to 30 seconds. And there's 15 to 30 seconds. You're going to let this area dry. And while we're letting this area dry, I'm going to take this second just to show you the Gelco. If you push this white button, it will withdraw the needle immediately, so don't push that until you're ready to do that. I'm going to talk about hubbing the needle, which means pushing this yellow part up just over the tip of the needle. So that way, when you get into the vein, you use the needle to get into the vein, but once you're into the vein, you can just hub the needle a smidgen so that when you advance the catheter up into the vein, the needle doesn't pop out the side of the vein. So it's kind of like a push-pull technique, like you're going to advance it while you're pulling back the needle. And this just takes practice. So you also want to make sure that the bevel is up. This is a 24 gauge and the bevel's pretty tiny, but the bevel is the open area on the top of the needle. All right, so my area is dry. I'm going to go ahead and insert my needle now. I'm going to go at a 15 to 30 degree angle. I'm going to take my thumb and I'm going to pull down to steady the vein, to immobilize the vein so it doesn't roll anywhere. If I use it to pull down like this, it also makes it nice and taut and makes it so it doesn't go anywhere. So 15 to 30 degree angle is what you're shooting for. Bevel is up, and you insert. Once you see blood, you lower it flush to the skin, and then you hub the needle. Can you see that? Mm-hmm. And then you just advance all the way. We do not want to see any of the catheter out. So if you can see this, you can't see any of the catheter. It's all inserted into the vein. So now that I have that in, I want to ever so carefully hold on to this area right here, and I'm going to put a 2x2 underneath here, and I'm going to release my tourniquet. Releasing the tourniquet will decrease the pressure of the blood backflowing while I disconnect and apply my extension tubing. So making sure I don't want to be touching up here. I only want to hang on to this yellow part right here. That's stabilizing it. Then now is when you push the white button, and it's going to pop out like that. Now you see the blood dripping down. One thing I forgot to say is if you can stabilize this with your left finger and take your pinky finger and sort of try to occlude the blood up on top of where the vein is, then that kind of helps to diminish the amount of backflow. But sometimes with these mannequin hands, it doesn't work anyway. But that's the idea. And the whole time you're keeping this stable. So you see, you still can't see any of my catheter. It didn't come out, nothing moved. So now you're just stabilizing this. Now you want to make sure that your catheter is in the vein. So you want to pull back a little bit. Yep, I see the blood. And then you're flushing 2 mLs according to your MAR. So you flush it, and then you can disconnect it, being ever so careful not to let that move. Then you want to apply the tegaderm, and the tegaderm goes all the way up to the twisty part of your extension tubing. And then you go like this. So you want to kind of make sure that is nice and secure there. Then you want to take this part off. And then you want to put your label on the side. And now you are done, except one thing that I'm kind of glad that this happened, this is a really good vein and you can see the blood back flowing into here. This is the reason you clamp it. After I flushed, so time out. After I flushed, you see how nice that looks? Now clamp it, and then the blood won't backflow. And then it looks nice and pretty for the patient. So you want to then, you don't want to just let this hanging there. You want to take this and tape it however it's going to lay. You generally don't want to put the tape over the tegaderm because if you need to move the tape, it's kind of a pain to get it off that tegaderm. And then, how are you doing, Mr. Smith? Yep, you're doing okay? Okay, so then I would clean up, I would document, and that completes the skill.